I'm Jenny Zablah. I'm one of the congenital interventional cardiologists. We are a big children's hospital that has a very specialized cardiac catheterization laboratory where we work with kids and adults with congenital heart disease. We have a patient that is in his 20s and has a complex disease where the pulmonary veins, which are the veins that drain the blood with oxygen to the heart, are not connected to the right side, which is like the left atrium. Rather, it goes to the vein that brings blood with that oxygen to the body. So the complexity is that those veins usually need to be surgically repaired, but the patient has other disease and comorbidities, we call them, that may complicate any surgery. So then we're trying to find an alternative to doing the cath lab. And for that, we need to have a good relationship between a hole that is in the heart and where the veins are coming so we can intervene to fix them. So this patient, the interesting thing is we need a 3D view of how the veins come in relationship with the rest of the structure of the heart. And that's very rarely possible with a 2D image. So we need a 3D view of all the structures to understand that. So as we can see, there's like structures all over the heart that is very hard to know what are they doing inside the heart. So we open this up, we can see how that looks. So we have here a hole inside the heart, and also the veins are come abnormally right there. So this way we know the stent comes in through the vein, this vein, into the heart, and we can make sure that there's no obstruction of important drainage of vessels, but also is going to fix the issue and make the patient feel better and avoid a surgery. So we needed to see that with this model. Otherwise, it's pretty difficult to assess what the actual structure of the heart is. So for that, we needed this in a real size model. So this is the real size for the patient, which as you can see is pretty dilated. If you compare with my hands, it's pretty significant, and it's very useful to know what size of stent to use as well. Our patient will be able to avoid an open heart surgery, which is a big deal for people that have other comorbidities like lung issues, kidney issues. So this is going to be a very less invasive procedure, most likely less time of recovery. And the whole thing means that less time for the procedure because we will know what devices we need to use and what other things we need to have planned for this patient. So overall, decreases the planning during the procedure and just makes things more efficient and safe for the patient. 3D modeling is a great tool that can be used for procedural planning to also education for trainees, students, and patients. So it's not just a great thing for physicians, but also for communication with patients and their families. Well, the first one that comes to mind is innovative. They've been able to create a lot of technology and tools and workflows that have been cutting edge, especially for my field in cardiology and especially in congenital heart disease. That's the first one. The second one is reliable. They have been able to work with us incredibly, and we can trust them for time frames that are very, very short to get product for us and for procedural planning and specific for high-risk babies. And the third one is responsible. I think they are a very big organization now that they're growing slowly thanks to being responsible, not just with other physicians and the information about our patients, but also the accuracy of their models. That it's a lot of responsibility over a big company to make sure that they're as accurate as possible so we can treat patients the best way.